For many people with cancer in India, the journey has been incredibly challenging. The emotional and physical toll of battling this disease is immense, and the financial burden often adds to the stress. Families find themselves navigating a complex healthcare system, seeking the best possible treatments while grappling with the high costs associated with advanced medical care. The hope for a cure or even a significant improvement in quality of life can sometimes feel out of reach. But amidst these struggles, there is a glimmer of hope that is beginning to shine brighter, and around the world, a special treatment called CAR T-cell therapy offered hope. This innovative therapy involves modifying a patient's own T-cells to better recognize and attack cancer cells. It's a groundbreaking approach that has shown remarkable results in clinical trials, offering new possibilities for patients who have exhausted other treatment options. However, the complexity and cost of this therapy have made it accessible to only a limited number of patients, primarily in wealthier countries. The high price tag has been a significant barrier, preventing many from benefiting from this life-saving treatment, but it was very expensive. The cost of CAR T-cell therapy can run into hundreds of thousands of dollars, making it out of reach for many families. This financial strain adds to the already heavy burden of dealing with cancer, leaving patients and their loved ones feeling overwhelmed and desperate. The high costs are due to the complex process of creating the therapy, which involves sophisticated technology and extensive laboratory work. For many, the dream of accessing such advanced treatment seemed impossible, a distant hope overshadowed by the harsh reality of financial constraints. Now, something amazing from India is changing things. Indian scientists and researchers have been working tirelessly to develop a more affordable version of CAR T-cell therapy. Their dedication and innovation have led to a breakthrough that could revolutionize cancer treatment not just in India, but globally. This new development is a testament to the power of scientific collaboration and the relentless pursuit of solutions that can make a real difference in people's lives. The fruits of their labor are now beginning to be seen, offering new hope to countless patients and their families. NextCAR-19, India's first CAR T-cell therapy, costs much less, making this life-saving treatment possible for many more people. This innovative therapy has been developed with a focus on affordability without compromising on effectiveness. By leveraging local resources and expertise, Indian researchers have managed to reduce the production costs significantly. NextCAR-19 is now being administered to patients who previously had no access to such advanced treatments, bringing new hope and possibilities. This development is a game changer, opening doors to better healthcare for those who need it most. This is a big moment in fighting cancer, not just in India, but everywhere. The success of NextCAR-19 is being watched closely by the global medical community, as it represents a significant step forward in making advanced cancer treatments more accessible. International collaborations are being formed to learn from India's approach and potentially replicate it in other countries. This breakthrough is a shining example of how innovation and determination can overcome barriers, bringing hope to millions of cancer patients around the world. The impact of this development is far-reaching, promising a brighter future for global healthcare. It shows how smart, new ideas can make healthcare better for everyone, especially those who need it most. The story of NextCAR-19 is a powerful reminder that with creativity and perseverance, we can find solutions to even the most daunting challenges. This breakthrough is not just about a new treatment, it's about changing the way we think about healthcare and making it more inclusive and equitable. By prioritizing affordability and accessibility, we can ensure that life-saving treatments are within reach for all, regardless of their financial situation. This is the true essence of medical innovation. In this video, we'll learn about the science behind NextCAR-19, how it was made, and the incredible journey of the researchers who brought this therapy to life. We'll explore the cutting-edge technology and innovative processes that have made this breakthrough possible. From the initial concept to the final product, we'll see the dedication and hard work that went into developing NextCAR-19. This story is a testament to the power of human ingenuity and the relentless pursuit of better healthcare solutions. Join us as we delve into the fascinating world of CAR T-cell therapy and its potential to transform lives and how it's helping people. We'll hear from patients who have received NexCAR19 and their families sharing their experiences and the impact this treatment has had on their lives. These personal stories highlight the real-world benefits of this breakthrough therapy, offering hope and inspiration to others facing similar battles. The journey of NexCAR19 is a beacon of hope, showing that with determination and innovation, we can overcome even the most formidable challenges. This is a new dawn for cancer patients, a time of renewed hope and possibilities. CAR T-cell therapy is a groundbreaking new way to fight cancer. Unlike traditional treatments like chemotherapy and radiation, which can harm healthy cells along with cancer cells, CAR T-cell therapy uses the body's own defense system to target and destroy cancer cells more precisely. This innovative approach harnesses the power of the immune system, which is the body's natural defense mechanism against diseases. The immune system is made up of various types of cells, each with a specific role in protecting the body from infections and other threats. One of the key players in the immune system is the T-cell, a type of white blood cell that acts like a soldier, patrolling the body and attacking invaders. In CAR T-cell therapy, scientists take these T-cells from a patient's blood and modify them in the lab to make them even stronger and more effective at fighting cancer. These enhanced T-cells, now called CAR T-cells, are then infused back into the patient's body. This process involves a medical procedure where the modified cells are carefully introduced into the bloodstream, ready to seek out and destroy cancer cells. Once inside the body, these supercharged CAR T-cells go to work. They are designed to recognize and bind to specific proteins on the surface of cancer cells. This binding triggers the CAR T-cells to attack and kill the cancer cells, effectively eliminating the threat. CAR T-cell therapy has shown remarkable success in treating certain types of blood cancers, such as leukemia and lymphoma. Many patients who had not responded to other treatments have experienced significant improvements and, in some cases, complete remission. This therapy offers new hope for patients and their families, providing a potential lifeline for those who have exhausted other treatment options. As research continues, scientists are hopeful that CAR T-cell therapy could be expanded to treat a wider range of cancers, bringing us closer to a future where cancer can be effectively managed or even cured. NexCAR19 is a big win for Indian science. It shows how good India is getting at making new treatments. This new therapy helps people in India and other countries where regular CAR T-cell therapy is too expensive. We'll talk about the problems with the old therapy, how NexCAR19 was made, and how it's helping people. Get ready for some inspiring stories. The old CAR T-cell therapy was great, but it cost a lot of money. Making it is complicated, which makes it expensive. Also, not many hospitals offer it, and insurance doesn't always cover it. For many families in India, it was just too expensive. 8-year-old Anya from Mumbai had a type of blood cancer. Her journey began with a sudden illness that left her parents, Priya and Raj, in a state of shock and disbelief. They rushed her to the hospital, where doctors delivered the devastating diagnosis. She had lots of treatments, but the cancer kept coming back. Each round of chemotherapy and radiation brought hope, but also fear and uncertainty. The hospital became their second home, and the medical staff, their extended family. Her only hope was CAR T-cell therapy, but her family couldn't afford it. The cost was astronomical, and despite their best efforts, they couldn't gather the necessary funds. They applied for loans, sought help from charities, and even started a crowdfunding campaign. Anya's mum, Priya, said, "We sold everything, but it wasn't enough. We felt so helpless." The emotional toll was immense. Priya often found herself crying silently at night, while Raj tried to stay strong for the family. Anya's story is sadly not the only one. In the hospital waiting rooms, they met many other families facing similar battles. Each story was a testament to the resilience and love of parents fighting for their children's lives. Many families face the same problem. The financial burden of life-saving treatments is overwhelming. Communities often come together to support these families, but the need is always greater than the help available. Anya's story is a call to action, a reminder of the urgent need for accessible healthcare for all. NexCAR19 finds a special thing called CD19 on cancer cells. First, doctors take T-cells from the patient's blood, then scientists change these T-cells in a lab to make them see and attached to CD19. When these changed T cells go back into the patient, they find and destroy the cancer cells. Scientists in Pune and doctors in Mumbai worked together to make NextCar19. They found a way to make it in India, which makes it much less expensive. This is great news for people in India and other countries. Tests of NextCar19 have shown great results. Many people got better. 12-year-old Rohan had tried many treatments, but nothing worked. His dad Vijay said, "We had lost hope. NextCar19 was our last try, and it was a miracle. Rohan is now cancer-free." Rohan's story gives hope to many families. NextCar19 costs much less than the old CAR T-cell therapy. This is a big change for people in India. Hospitals across India are starting to offer NextCar19 so more people can get it. People all over the world are excited about NextCar19. It shows that India can make great new treatments. NextCar19 might be sent to other countries too. Scientists in India are now working on using CAR T-cell therapy for other types of cancer. It's important to tell everyone about NextCar19. By sharing this information, we can help more people like Anya and Rohan. Let's spread the word. NextCar19 shows how new ideas can make healthcare better for everyone. It gives hope to people with cancer all around the world. Let's support research and new ideas so everyone can get the best treatments, no matter where they live or how much money they have.